Welcome everybody. My name is Doug Rains. I am the Program Director for Genetic Testing at Merit Laboratory Partners in Franklin, Tennessee. And what I want to do is talk a little bit about PGX testing, specifically the swabbing process and also sample submission. And I want to do this because there are several errors that can happen during the collection process or the sample submission process that can really slow down us getting the testing done. You know, there are reasons that we might have to reject a sample or repeat a sample. And so what I want to do is just kind of cover some things that will help minimize those problems. So on this first slide, what I've done is I've included all of the different components of a sample collection kit. We of course have the pharmacogenetic testing requisition, and I'll talk more in just a minute about what information absolutely has to be filled out in order for us to accept the sample. We have instructions for doing the swabbing, and finally, of course, there is the envelope and the two swabs themselves. A couple of things that I think are really important for you as sales reps to pass along to each of the physician practices has to do with the sample collection, because if we don't get this right, if the sample collection isn't done properly, it doesn't matter how good the laboratory is, we can't save the sample. And ultimately, we'll have to ask for a re-swab. That's going to delay things and cause frustration. We don't want any of that. So one thing I would recommend is say to the physician practice, look, very important that the patient hasn't eaten, brushed his or her teeth, or chewed tobacco in the hour leading up to swabbing. Now, the hour isn't an absolute. You know, it's not that we can't necessarily get away with it being 30 minutes or 40 minutes. It's just that an hour seems to really maximize the chance that we're going to get a good swab. And the other thing that can help is if the collector, whoever that is, if it's a nurse or MA, that person should ask the patient to rinse his or her mouth with water right before swabbing, because that's going to get any kind of nasty stuff out of the patient's mouth. And one of the biggest problems we see over and over again is sample collectors not spending enough time swabbing the patient's cheek. And so that's why we say minimum 30 seconds with each swab. And, you know, the problem I've seen is that a lot of people think 30 seconds is a lot shorter than it really is. And so they end up swabbing for maybe 10 seconds. We don't get nearly enough DNA to do the test on that swab. So I would say recommend to each physician practice, hey, have your MA or nurse set a timer for 30 seconds. In terms of getting those sample tubes ready to send back, we need to label each of the tubes with the patient's name and birth date. We've got to have 2 unique identifiers, and you need to stick a barcode onto the tubes. And of course, those barcodes peel right off of the rec forms themselves, so they're easy to affix. And that really helps us at the lab so that we don't mix up samples. And again, if we don't have those identifiers, we have to reject the sample. In terms of shipping, you're going to get pre-labeled envelopes, and these need to include the following items: the completed testing rec form. We would love to have a patient's current list of medications. This isn't required. All right, we're not going to reject a sample if we don't have that list of meds, but it does help personalize the reports, and so I think it gives a better product ultimately. And then finally, we have to have the patient's insurance information. So what we're looking at here is the top half of the requisition form itself. I want to talk about what information must be included. We can't process the sample without the patient's last and first names and date of birth. We'd like to have the date collected because that helps us with quality control. You know, I've highlighted this whole section for the provider. We don't necessarily need everything here, but we need enough to uniquely identify the account. You know, sometimes you might have a practice that has multiple locations. We would need to know which location we're dealing with, right? And of course, we got to have the requesting provider's name. We can't really go forward without diagnostic codes, so writing in those ICD-9 codes is very important. And as I've mentioned already, patient insurance information. That can be attached separately on, let's say, a patient demographic form. That's fine, but we must have that insurance information. And then finally, for the top half of the rec form, the physician has to select a panel. Most are going to want to check the medical management panel. That covers everything. But maybe not. They may want to focus just on pain medications or cardiology. If we then look at the bottom of the rec form, here it's a lot simpler. We just have a couple of things that need to be filled in, and that would include, of course, the patient signature and the provider signature. And that's really it. That's all I wanted to cover in this video. Just the quality of swabbing and then what needs to be on that rec form. Really important so that we can have a fast turnaround for everybody and get everyone paid as quickly as possible.